The broadcast is now starting. All attendees are in listen-only mode.
Hi, and welcome to Fight Colorectal Cancer's webinar series, Medicare Cost Sharing for Screening Colonoscopy. This is our monthly webinar series that we are doing a little bit differently this month, and we are happy to have as our speaker Camille Banta, who is our policy expert. You'll find this webinar along with our other archived webinars at link.fightcrc.org/webinars. If you have any questions regarding the material, please feel free to call our answer line at 877-427-2111. Along with our webinars, we are also proud to talk about our Lisa DeBow Fund, which is geared towards research funding, and there's an opportunity for us to extend our research initiatives, and we invite you to join and look at the information we have on our research section of our website, and that's the Lisa DeBow Fund. Some disclaimer information or housekeeping information. The services provided by FightCRC are the general information purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnosis, or treatment. If you are ill or suspect that you are ill, see a doctor immediately. In an emergency, call 911 or go to your nearest emergency room. FightCRC never recommends or endorses any specific physicians, products, or treatment for any condition. And now, without further ado, here is Camille Banta, from Principal of Summit Healthcare Consulting.
Great, thank you. And again, welcome to Fight Colorectal Cancer's advocacy webinar on Medicare beneficiary cost sharing for colorectal cancer screening colonoscopy. This webinar is designed to prepare you for speaking to members of Congress about policy changes that are needed to eliminate a remaining financial barrier to screening colonoscopy for Medicare beneficiaries. Under current law, there are no cost-sharing obligations for Medicare beneficiaries who receive a colorectal cancer screening colonoscopy unless a potentially precancerous polyp or other tissue is removed during the screening procedure. In such cases, the test is no longer technically classified as a screening, and the beneficiary is liable for paying the coinsurance. I want to take a moment to point out that on February 20th, the federal government issued a clarifying communication stating that private insurers, most of which are required to cover preventive services without cost sharing under the healthcare law, cannot impose cost sharing for a screening colonoscopy when a polyp is removed. This change that had been advocated by Fight Colorectal Cancer, and while a very important victory for privately insured patients, a change in Medicare policy still requires action by Congress. A change in law is needed because a growing body of literature shows that cost sharing creates a disincentive to obtaining preventive services. A recent study found that during the recent economic recession, insured Americans aged 50 to 64 reduced their use of screening colonoscopy, and that screening rates decreased the most among those with high direct out-of-pocket costs. A change in law is needed also because 1 in 3 Americans are not up to date with recommended screening. While there has been a downward trend in colorectal cancer incidence, screening rates still lag behind the healthy people goal of achieving a screening rate of 70.5% by 2020. Fight Colorectal Cancer advocates must convince their members of Congress that corrective action is needed this year. Current Medicare policy is confusing to patients and healthcare professionals. It serves as a disincentive to screening colonoscopy by Medicare beneficiaries, and it could cause current downward trends in colorectal cancer incidence rates to stall or decline. Colorectal cancer screening colonoscopy is the most cost-effective test for the prevention of colorectal cancer because a screening colonoscopy allows for the removal of potentially precancerous polyps during the procedure, making it a unique preventive service. The cost to Medicare of a screening colonoscopy is nominal compared to the $300,000 or more it costs annually to treat an advanced case of colorectal cancer. Before we examine the cost-sharing history for colorectal cancer screening, let's review what cost-sharing entails. The deductible is the amount you have to pay out of pocket for expenses before Medicare will cover the remaining costs. The coinsurance is a set percentage of the covered costs the Medicare beneficiary will need to pay after the deductible has been paid. To explain to lawmakers and their staff about why a change in law is required, it helps to understand the history of colorectal cancer screening coverage and cost sharing. In 1998, Medicare began covering screening colonoscopy for high-risk individuals and expanded coverage to average-risk individuals in 2001. In an effort to remove cost barriers to colorectal cancer screening, a 2006 law included a provision that waived the beneficiary deductible for colorectal cancer screening. After this change in cost-sharing policy took effect, it became apparent that Medicare beneficiaries would still be liable for the deductible if a polyp was removed during the screening colonoscopy. This was because, for Medicare billing purposes, when a polyp was removed, the screening was reclassified as diagnostic. Because the service was technically no longer a screening, the deductible was not waived and the Medicare beneficiary got a bill. The 2010 healthcare reform law corrected the deductible problem, but at the same time created a new problem. The Affordable Care Act includes an important provision that waives Medicare beneficiary deductible and coinsurance for all preventive services that have an A or a B rating from the U.S. Preventive Services Task Force. 3 colorectal cancer screening tests, colonoscopy, sigmoidoscopy, and fecal occult blood tests, all have an A rating. As a result, the health reform law, for the first time, waives Medicare beneficiary and coinsurance for the colorectal cancer screenings. Unfortunately, due to an oversight in the law, Medicare beneficiaries remain liable for coinsurance when a polyp or other tissue is removed during the screening colonoscopy. This oversight in the law requires corrective action by Congress. Fight Colorectal Cancer is actively working to have legislation introduced in the House and Senate by March 20th that would amend current law to waive coinsurance for colorectal cancer screening colonoscopies that also involve the removal of polyps during the same encounter. Fight Colorectal Cancer advocates need to educate their lawmakers about this oversight and request that Congress take corrective action this year to remove this outstanding financial barrier to colorectal cancer screening colonoscopy for Medicare beneficiaries. To conclude, the most effective advocate isn't the person who comes armed with a bag full of statistics, but someone who can tie their personal story with key messages and facts. Prevention of colorectal cancer is not a Republican or a Democratic issue. It's a public health issue with a long history of bipartisan support. Colorectal cancer screening has been promoted as a health screening without cost sharing for Medicare beneficiaries, but for half of Medicare beneficiaries who have a screening colonoscopy, there is a cost liability, and corrective action is needed this year. Thank you.